Hi, I'm Jamie Barrow, and I'm doing my research presentation on vitiligo, and it's for my Bio 137 class. Okay, the first slide I want to talk about is my first one to get started. It just says my name and the research project. Okay, what is vitiligo? It is a skin disorder that causes skin to lose its pigment in patches or macules. Generally starts on the hands, forearms, feet, and face, and has smooth white areas. If it's less than 5 millimeters, it's called a macule, and if it's larger than 5 millimeters, it is a patch. The condition occurs when the melanocytes are destroyed by the body's immune system. The skin cells that produce melanin, which is a chemical that gives skin its color or pigmentation, are destroyed by the body's immune system. So it is a disorder that attacks the immune system, and the cells that produce the skin color are attacked. So it will result in white patches on your skin. And if you're darker skin color, then it's going to be more prominent than it is if you're lighter skin colored. Okay, alternative names of vitiligo is leukoderma. Leuko in Greek means white, and derma means skin. The symptoms are white, well demarcated oval macules and patches, and unpredictable rate of spread enlargement of these patches. There's premature whitening or graying of the hair and light color hair. There's changes inside the mouth and nose also, which are white spots on inside your mouth and on your head. Where the hair is, there'll be lighter color hair on places where there's patches or macules. Okay, the next slide is photos of vitiligo, and you can see in the first picture that the girl has it around her eyes and around her mouth, and that's usually where people have it, and their hands, and again, here's the one with someone with it around their mouth and nose. Okay, vitiligo is an autoimmune disorder in which white patches of skin appear in different parts of the body, like I explained earlier, and it is an autoimmune disorder. The cells that produce pigment in the skin are destroyed. It's rare disease, which has only 1% of population has this disease. Treatments can help manage, but there is no known cure. It can be several years or lifelong, and usually it's going to be lifelong because there's no known cure. The causes are hereditary because they do not know of anyone else that has it, that their parents or a grandparent hasn't had it. It is an autoimmune disease wherein the immune system fight against other cells that make the pigment. It shows up due to stress, over exposure to sun or chemicals. It could happen to you when you're a child, an adult. It doesn't matter the age. It could, and it usually comes more present whenever there is something that's caused it. Okay, who does vitiligo affect? It affects any race, any age, anything. This not background or anything doesn't matter. It doesn't matter what color your skin is. You still have the same percentage if someone of a different color. How would the doctor diagnose the disease? Your doctor will ask about your medical history and examine your skin, possibly with a special lamp. You'll probably go to a dermatologist. Your evaluation might also have a skin biopsy where they will take a biopsy of your skin. The test the doctor could run would be an anti-nuclear antibody test, which is an ANA, a CBC or a complete blood count, or a skin biopsy. To treat vitiligo, there is no known cure for vitiligo, but there are creams and medications that can help. The treatments usually have bad side effects, but they can help with the disease. The corticosteroid cream and corticosteroid pills are commonly used, and Protopic or Elidel. Also, there is a light therapy. It's a phototherapy with a ultraviolet B ray, and it has shown to slow down or stop progression. You would do it 2 to 3 times a week, and you wouldn't see a change between 1 to 3 months. It affects long term. Mostly, it affects people's self esteem, and people that has vitiligo, their self esteem usually suffers from it because they have to deal with what does other people think of them, and is the spot showing, and it could affect them all through their whole life with their self esteem. Celebrities with vitiligo is the first one, Winnie Harlow. She is a model and a spokesperson. Actually, she is a spokesperson for the disease, the Vitiligo Foundation disease, and she is also been a Victoria's Secret model. She has this vitiligo all over her body, and it hasn't stopped her and to achieve her dreams. And it shows people that she's comfortable with her skin, and no matter what, that you can do and be what you want to be, and it doesn't matter about your outside, but what's inside that makes people who they are, and to never give up. Another person is Michael Jackson. A lot of people thought that he just was bleaching his skin and stuff like that, but it later found out after his autopsy he did have vitiligo, which earlier pictures before he was used skin bleach and other stuff, you could tell the spots around his hands. Another person also is Joe Rogan. He's another spokesperson, and he's also a person on Fear Factor, or the host on Fear Factor. He also had it and just has talked about it. Okay, here's my references. And in conclusion, I really enjoyed researching this skin disease and autoimmune disease, and I look forward to learning more about other diseases and doing the research. And I hope you enjoyed, and I hope you have a great day. Thank you.